Good afternoon, everyone. My name is Chris. I'm a Can Hep C Summer Student Award recipient. I'm a member of the Métis Nation of BC, and I'm currently completing the final semester of my health sciences degree at Simon Fraser. I'm hoping to pursue a Master's of Public Health this upcoming fall. Now, I take great pride in my Indigenous heritage, and it's been this facet of my life that has influenced much of my academic, research, and career interests. I strongly believe that culture is medicine, and this relationship between culture and healing has been a core consideration throughout the course of the Water Journey project. Now, water is a unifying element amongst all Indigenous peoples in Canada. It is the lifeblood, and hepatitis C is transmitted through blood. Paddling through water implies agency and control in navigating towards healing and wellness for those Indigenous people who have been impacted by hepatitis C. So, Water Journey, community-directed research priorities for Indigenous peoples in Canada and hepatitis C. The journey begins. So by now, I'm sure that most of you are well aware that Indigenous peoples in Canada experience a disproportionately high burden of hepatitis C. And furthermore, the issue must be framed within the context of historical and ongoing trauma. Now, the hepatitis C landscape is changing dramatically. We have these newer, more effective treatments, as well as new treatment and screening guidelines. And because of this, there's a pressing need for a Hep C research agenda that's developed by and for Indigenous peoples. So the purpose of our project was to use a decolonizing and community-based approach to elucidate and explore ways in which we can aid Indigenous peoples living with Hep C in their healing journeys. We want Indigenous peoples in Canada to be able to take full advantage of the continuum of Hep C care. And to do this, we need to develop a national research framework for Indigenous peoples and hepatitis C. So our methods. Our project was grounded in the two-eyed seeing approach that Dr. King just described. This is where Indigenous ways of knowing and Western research approaches combine in order to gain a holistic perspective on a health-related issue. We began the project with a scoping review. We systematically searched the academic and scholarly literature on Hep C and Indigenous peoples to see what research had already been done. This then went on to inform our research and wellness event, which consisted of a series of sharing circles. Now, sharing circles are similar to focus groups, but they're imbued with Indigenous processes and protocols. Also within our research and wellness event, we had cultural activities, ceremony, song, dance, and drumming, as well as support and guidance from our elders. So in July of this past summer, we held our research and wellness event in Vancouver. This was our data collection phase. We held 4 sharing circles that ran concurrently. We had a male sharing circle, 2 female sharing circles, and a two-spirit sharing circle. Each one of these was facilitated by an Indigenous elder, and we had a total of 42 participants. The discourse in the sharing circles was guided by a series of questions, such as, what is your experience of being an Indigenous person living with Hep C? What have you learned that you can share for the benefit of others? Have you encountered barriers? Have you been able to navigate these barriers? Now, the discussions in the sharing circles were then transcribed and analyzed qualitatively using a grounded theory-based approach in vivo 10 software. From this, 6 cross-cutting themes emerged from the collective discourse in the sharing circles. Now, before I get into these 6 themes, I must acknowledge our participants for the wisdom and the insight that they provided. I must also acknowledge the great contribution of one of our team members, Alicia Kalos, in contributing to the development and refinement of these 6 themes. So our results. The first major theme was that of strength, resilience, and hope. Now this is an overarching theme that is woven throughout the other themes. Many of our sharing circle participants discussed the importance of learning and mentoring from sharing stories and experiences. Many talked about both individual and community healing journeys, as well as emphasized the importance of the active inclusion of Indigenous peoples in driving the Hep C research agenda forward. The second major theme was intersectionality. So many different factors intersecting to affect one's experience with hepatitis C. The psychosocial and cultural realities of Hep C are shaped by the interaction of many things, such as complex and systematic injustices and inequities, upstream factors like indigeneity, gender, colonization, but also factors such as drug use, homelessness, incarceration, stigma, and co-infection with HIV. Now, all of these are experienced in unique ways by Indigenous people, which leads to unique considerations in terms of treatment, prevention, support, and healing. The third major theme was barriers. Many of our sharing circle participants discussed a mistrust of the medical system, both historical and current. Many also talked about facing socioeconomic and geographic barriers to care, as well as feeling anxiety and fear related to treatment and its side effects, as well as experiences of depression, hopelessness, and thoughts of suicide. Now, all of these experiences highlight the need for improved access to new treatments, support services throughout the continuum of care and afterwards, as well as access to holistic healing and traditional medicines, psychosocial support, cultural support, elder support. The next major theme concerned the conflicting priority of Hep C in one's life. Now, Hep C often receives a lower priority in one's life due to many other conflicting priorities. Furthermore, Hep C is often asymptomatic or causes nonspecific symptoms, especially in its early stages. The priority of Hep C in one's life is also affected by things such as stigma, individual circumstance, healthcare provider decisions, as well as systems level issues. So what we need here is a balance between being proactive about treating one's Hep C, as well as addressing other acute and chronic comorbid factors. Now, the next major theme was health literacy. Many of our sharing circle participants discussed a lack of Hep C knowledge, both on the part of themselves as well as on the part of healthcare providers. Many talked about hearing mythology, so misinformation and horror stories about treatment and its side effects. Also within this theme was a lack of access to appropriate information throughout the continuum of care in terms of timing and format. The last major theme was transformation, and this is the importance of finding purpose along one's healing journey. Many describe this as a turning point or an event or a cause which gave them a sense of purpose, and it was unique to each individual. Some examples included cultural and spiritual involvement, volunteering, activism, or just simply providing support for others or a loved one. So to conclude, our project underscores the need to meaningfully involve Indigenous peoples and communities in the process of deciding Hep C program and research priorities. Within this, our focus must be placed on self-determination, integration of services, cultural safety, and strengths-based approaches. And the themes identified by the Water Journey Project must be taken into consideration across the realms of policy, prevention, research, and the continuum of Hep C care. So, what does this all mean? Well, ultimately, we endeavor to learn from Indigenous experience. We want to learn from stories. Within our culture, stories are used as tools for teaching and learning. Now, many Indigenous peoples with lived experience of Hep C show great strength and resilience in the face of a lifetime of adversity. So in listening to the stories that these people have to tell, we need to ask ourselves, how do we build upon this resilience? And how do we enable it in others? And in the wake of the changing Hep C landscape, how do we apply this to health practice to ensure that Indigenous peoples aren't left behind? This is what the Water Journey Project and the larger research agenda that it will inform hopes to accomplish. Our journey continues. Thank you.
Thank you very much, Chris. Why don't you stick around? There might be a couple of questions. Any questions for this very interesting presentation? Everyone digesting lunch still? No, there's a question.
Hi.
There you go.
I have two questions. One is the themes that you identified, the two of them, intersectionality and transformation. Those titles or those theme names, how were they represented in the conversation that you had with the communities? What were they the theme names given, or how else were they represented? And my second question is, you talk about continual care, but did prevention not come up at all? It's not within the framework at all, and I was just wondering if there was any discussion around prevention.
Okay, good questions. In terms of the theme of transformation, many of our sharing circle participants, they described some sort of event in their life that gives them hope and purpose along their path towards healing. And it was very subjective and different between all participants, but it was a reoccurring theme that many people who considered themselves to be doing well, living with Hep C, they had this theme in their life of a transformative either event or experience or something that gave them purpose. In terms of prevention within our project, it's certainly a consideration, but most of the people that participated in our sharing circles themselves were either living with Hep C or had cleared Hep C. So the focus was more on how can you embark upon this healing journey with Hep C.
Chris, I'd like to add on to what you said. A lot of the people living with hepatitis C provide prevention to their families. It's not just amongst us, it's amongst our kids, and it's amongst our family.
Thank you, Leona.